that we can ever hope to achieve just by that interaction. And as such, social inclusion is then promoted. But when people are well also, people can and people do and want to move off benefits. And we know that this is resonant with government, because 40% of incapacity claims we know relate to mental health problems. At Action Mental Health, to achieve this, we have to and must nurture effective partnerships. And as Peter has explained, from an employment point of view, we create real opportunities for people to attain and retain employment. We've heard from Billy and Nicola, when all of those components work together, how it works best for people. And again, from a government point of view, we know that this is important from an economic point of view. We hear in different figures. My figure is 750 million, but I think the general consensus is that it costs a lot. Mental ill health costs the public purse a lot in the care and treatment, and also in the loss of earnings and productivity within the economic world. So we must do more to work in a preventative way. We and others must do more here and place a greater emphasis on preventative approaches that will lead to effective support for people in need. At the opening last week of the new Bamford Centre, Professor Bunting informed us that in Northern Ireland, levels of mental illness are 25% higher than of those of people in Britain. The cost of treating people with anxiety disorder in Northern Ireland is a whopping £95 million. But even more shockingly, that report identified that people with anxiety disorder take on average 20 years to seek support. 20 years. So what prevents someone from seeking the support that they so clearly need? We've touched on it this morning, and it's stigma. That fear of being identified as somebody who has got a mental illness. And one of the biggest barriers to effective support at any level is stigma and the social construction of mental illness. So we must do more to work in a preventative way to meet the problems that we face. Our service, Action Mental Health in Sana, has for 10 years implemented an effective mental health promotion approach to meeting the needs of young people and their key contacts. I know it's effective because when we started this back in '91, we couldn't get an audience. Now we can't find the time to meet the demands being placed upon the service. It's quite an innovative service. It uses drama, art, interactive workshops, films, and such like to get key messages across. But it works because we involve young people in the design and delivery of what it is we do, and their key contacts. The basic premises behind the Mansana approach is that we raise the value of mental health and mental illness among young people. We make it more important for people to identify when they're not well, to encourage people to get support at an early point. And we address it also from the adult side in relation to the key contacts that someone may come into contact with, parents, teachers, youth workers and others, to look out for signs that may indicate that maybe not everything is well, to approach people and suggest that they may want to seek support. We work directly, as I say, with the young people and their key contacts. We develop resources and sessions that will identify the needs of local communities. Depending on that contact and depending on what it is we do, work will include and has included suicide and self-harm prevention, mental health promotion, skills development, support for people and communities in the aftermath of incidences around suicide, as we have done, and I'm sure, unfortunately, will have to do in the future. In AMH, Mansana staff are qualified to deliver assist, mental health first aid, understanding self-harm, safe talk, and other approaches in capacity building in topics such as resilience and being positive and in bounds. We've also developed our own resource called Changing Minds in direct consultation with 5 schools in the Newry and Moore area in particular. And that is a sort of series of 10 short films that depicts the potential stressors in young people and how they might be best dealt with. As I say, we work across sectors. We work well with partners in education, health and in youth to realise the work that Mansana sets out to do. But we could do more, and we want to do more, particularly with education, to get in and get in early. The Mansana model is easy transferable. It would work in any locality. But we don't always get it right. And when we don't, we want to hear what it is we can do and how it is we can do what we do better. In summary, Action Mental Health has the ability, I believe, on behalf of my colleagues, to deliver modern mental health services. We are willing and committed to do so. We also, as David has said, the ability to source and secure funds from other sources, elsewhere taking off the pressure from the public purse. Help Action Mental Health do what it does best. Let us help you in your efforts in meeting and addressing the needs of mental health issues across Northern Ireland. But most of all, let us all collectively make sure that we achieve modern mental health services that are fit for purpose. Thank you.
Ladies and gentlemen, and MLAs who have had to go to the floor, hopefully that's given you food for thought. We'd very much now like to hear from you. We've done a lot of talking so far, it's over to you now. But before we break up, I'd just like to let those MLAs who are still here that we are holding meetings across our units, across the region, give you an opportunity to meet staff and clients. But I would urge you, as we've been saying all along, to use your influence to make mental health a priority, not just now, but also for the next Assembly. We have made progress on the issue with strategies and with Bamford, but there's much more that needs to be done, just as Colin has been saying. So, we hope you found today informative and useful. A number of our clients are here, certainly there are a number of staff members here as well. And I would urge all of you who are visitors, supporters, to stay and have a cup of tea or coffee with them and learn something new. And again, thank you for coming. If you want, you can follow us on Twitter or Facebook, and you'll find our contact details on the back of the manifesto. Again, thank you for listening to this.